On this YouTube channel, we're not going to go into great detail regarding lower leg and ankle foot muscular strength building, but we do want to touch upon some of the basics. And one of the basics is non-loaded pretibial muscle training. To make sure your patient is not overly dorsiflexed at the beginning of this pretibial training, make sure that the patient walks their feet out in front of them in a seated position so that the ankles are in a plantar flex position to begin with. So again, something less than 90 degrees of knee flexion. At this point, we can easily begin some light, non-loaded pretibial muscle training with an alternating toe tapping exercise. If you then want to move into low load plantar flexor muscle training, we need to pre-position the ankles in a bit of dorsiflexion. And we simply do that by bending the knees to about a 90-degree position. And now the patient, in an alternative fashion, raises their heels off the ground one at a time. To continue with the strength building process, we have the patient stand, hold on to a sturdy piece of furniture, take a nice wide base of support, and shift their weight back and forth. And as they shift their weight to the right, they isotonically activate their pretibials on the left. As they shift their weight to the left, they isotonically activate the pretibials on the right. So the exercise looks like this. Make sure that your patient's safe, they have something behind them, and that they're holding on to something as well. Now let's have the patient turn and face something, okay, and do bilateral Achilles, gastroc and soleus strength building. And then in a patient who's able, unilateral strength building for their Achilles complex.